Hello, Habit Aware Instagram fam. We are on our last BFRB Awareness Week Insta Live and our second OCD Awareness Week Insta Live. I love how the two folks that I get to talk to today are also experts in OCD. So it's such a beautiful day to be able to be doing this, and I'm so excited to bring Kim Quinlan to the stage. Drum roll, please. Let me just make sure I can get that. Hopefully work. I know I accepted. Let's try one more time. Oh, oh,
Hi.
there. Hello. It's so nice to see you. Can you hear me okay?
I can. Can you hear me?
I can. All right. So, as you were coming on, I was just sharing my excitement for today being the last day of BFRB Awareness Week and the first day of OCD Awareness Week. And my other guest in the morning was Reverend Katie O'Dunn, who is in the OCD community and also in the BFRB community. So
hmm
I just love how that worked out.
She's amazing.
Yeah. Yeah, it was a great conversation. It was like the first time Katie and I really sat down, so it was kind of cool to just, have that introductory
Chat.
conversation with other people listening in. And Kim and I have known each other for gosh knows how long, since we started Habit Aware. But
Yes.
we also only just recently did a call together and
Yes.
caught up, so it was really nice, and I'm super glad that you're able to take time today. I'm going to let you introduce yourself in 1 second, but first I want to wish you a very happy birthday.
Ah, thank you. Thank you.
So please tell us a little bit about yourself, and since you are both a treatment professional for BFRBs and OCD, how you came to choose those as kind of your specialties.
Yeah, so my name is Kimberley Quinlan. I am an OCD and BFRB specialist. I specialize in obsessive compulsive related conditions. I coincidentally got an internship at an OCD center where I was trained. I had no I think had like one like maybe 20-minute presentation that was given to me on BFRBs in my master's degree. Very little about OCD, but I got an internship at an OCD center and I just fell in love with the work. So yeah,
That's so cool. I love how the universe sometimes provides in that way of
yeah,
just, you just happen to be at the right place, right time.
exactly. Yeah, I'm very, very grateful.
And so with BFRBs, how did you get into BFRBs? Like, I know you're very well versed in OCD and you treat and you train folks in that, and then BFRBs are kind of OCD and related um, conditions. Like, how did you choose to also gain expertise in that and be able to treat it?
So I didn't choose to
Okay.
learn how to treat it. I was required to treat it in my internship. And again, so grateful. So it was a part of my training in that I was required to um, treat OCD, hair pulling, skin picking, health anxiety. Like these are all the conditions. So I was so lucky to be sort of taught. I was given clients with BFRBs and taught along the way of exactly how we do it and the sort of the little differences between the treatment of, let's say, more basic cognitive therapy than with BFRBs being more habit reversal training and more of sort of a compassionate and act approach and sort of, Cone B model. So I was so lucky that, let's say, I had a client with OCD and a BFRB. As we were going through, I was also being, I was being supervised on how these conditions can interplay with each other, the line between one and the other, how to differentiate, and all of those things.
Amazing. Okay. So You were forced to learn this stuff basically.
Yeah.
It's pretty, thank you, universe.
Yeah, that's
One
what I'm
of,
saying. It
yeah,
was
yeah.
so good. It was so lucky. And I think I'm so lucky because so many people get trained in not helpful treatments.
Hmm.
And I was so lucky that I just got really, really, really good training, really
Yeah.
solid supervision on these cases, and especially when there is an overlap between them. So I'm just very, very grateful.
And I think one of the things that I have like such a fangirling kind of connection to you is because of that integrative approach that you've taken since 10 years ago when we started Habit Aware. I've saw that with you in terms of compassion, mindfulness, and even um, your like courses on like radical acceptance and radical compassion. Tell us a little bit about how those concepts play a role in your recovery program.
Hmm. Sure. So when I first started treating these conditions, a lot of my own work, I was doing my own mental health work. I was recovering from an eating disorder. So a lot of my own personal work was a lot of mindfulness, a lot of self-compassion. And I was in real time, like learning how beneficial. And what was interesting is while I didn't have a BFRB, and I didn't have OCD at the time, I had more of eating disordered behavior. I could see this overlap of my clients having very, very similar presentations. That voice was very mean. There was a lot of shame about having the condition. There was a lot of shame about how you were like doing this to yourself and what's
Mhm.
wrong with you, and a lot of that sort of negative talk. And so I just sort of started experimenting, right? There was no research at the time. Now there is lots of
Yeah.
research, but just experimenting. And I'm not in any way saying I was pioneering that. It was just really trial and error. And what I found was I applied on one of the conferences like 10 years ago to do a presentation on self-compassion. And it was fully like people were sitting on the floor up against the wall standing, not because they were there to see me, but because there was a huge need. People
Yeah.
really needed it. So um it's something that I love to talk about, and I think absolutely enhances treatment.
Wow. Okay, I just got like smacked in the face there a little bit with what, in a good way, in a good way, with what you said about the overlap of shame and lack of self compassion when it comes to many mental health conditions,
Yes.
eating conditions, hair pulling, skin picking, nail biting, BFRBs, OCD, anxiety. There's so much like negative self talk, negative self speak, negative self concept, even. Um, and then it almost feels like that's the mental health condition. It just manifests in different ways for different
Yeah.
people.
Yeah.
And this idea of, there's other folks in the community that have said this about BFRBs, that shame, like that BFRBs are a shame disorder, right? And when you can shift your mindsets away from that shame, the healing, you can start chipping away at
Yeah.
the pain and start healing. And so I don't doubt that that room was packed
Yeah.
with people needing to learn how to talk nicely to themselves and show
Yeah.
themselves compassion. How do you see that transforming your patients? That process.
Well, the clients who are able, it's not that they stop their negative thoughts.
Yep.
The clients who are able to not engage with their negative thoughts and have a different reaction, I find, tend to have longer recovery.
Mm-hmm.
The reason, and again, that's my experience, and I think the reason for that is when you're flooded with shame, it's very hard to respond in healthy ways. It's
Yep.
very hard. It's like trying to swim against the river, right? Like it's a very hard thing to do. However, if you can learn how to nurture that shame and hold space for that shame, and create a sort of a safe container for that shame to rise and fall, you then have a little bit of distance between you and that emotional experience so that you don't engage in sort of maladaptive behaviors, or picking behaviors or pulling behaviors or compulsive behaviors, or depressive behaviors or addictive behaviors. So I think that um, even if it's a 5% improvement in how you respond, I think it has really, really big benefits.
I love that. Yeah, and Mel, who I chatted with yesterday, I think it was yesterday, the days are all blurring together, mentions that feel it to heal it. I love
Yeah,
that. And that's exactly like how to sort of distance yourself from those thoughts that
yeah,
create shame. So OCD and BFRBs are in the DSM-5, which is the psychological handbook, as categorized as OCD and related behaviors. What are some of the things that you see that do kind of line up and say, yep, they're related? And then do you see anything about the two conditions that are like, this is where they kind of separate and sort of the fork in the road sort of thing, and how that changes the treatment for both of them?
yeah. So um, I always say to clients, imagine there's an umbrella, and under this umbrella of what's called an obsessive compulsive related condition are these little disorders. OCD is one, BFRBs, hair pulling and skin picking, are another. Another one is BDD, body dysmorphic disorder, right? A health anxiety. So these conditions are under this umbrella. They all have some similarities in that they get caught in this sort of cycle of obsession and compulsion, right? Your brain kind of gets stuck on something. It's sort of very repetitive and intrusive and unwanted. It's out of your control. And then there's this sort of response, a compulsive response to try and reduce or remove that feeling. So, broadly, they often follow that model. However, um, let's talk about BFRBs. Um, for folks with BFRBs, their behavior could be for multiple reasons. Sometimes it's there's more like a trance-like experience. Once you get going with it, you get stuck in it and you kind of lose track of time and you go into a trance. Sometimes people do it to reduce overwhelm. Other people do it because they are bored and it actually feels stimulating. Now, that is very specific to BFRBs, whereas with OCD, we tend to understand, and we're still learning and understanding more about the condition, is that we tend to engage in compulsive behaviors to reduce or remove uncertainty, or anxiety, or a feeling of maybe disgust. So while they may look the same in some cases, the function behind the behavior or the emotion behind the behavior is different. There is a huge overlap. And I think a big part of that overlap is the fact that they can take up a lot of time, impact your functioning, create a lot of shame. They're very, very genetic conditions as well.
For those of you just joining, I'm talking with Kim Quinlan, a treatment professional and expert in OCD and BFRBs, and it is the first day of OCD Awareness Week, the last day of BFRB Awareness Week. So we're talking about the relationship between the two, the comorbidity of the two. So feel free to ask questions. If you need to know what a BFRB is, that stands for body focused repetitive behavior, and it includes things like hair pulling, skin picking, nail biting, cheek biting, nose picking, lip picking, finger picking, basically anything where it's like a self-soothing, self-grooming behavior gone awry. You're welcome, Zikni. I don't know what the word is, but I answered your question for you before you
Yes,
asked it, or just
yes.
as you were. Um, so one of the things that I see in the BFRB world is that, oh, well, we got a great question here. Let's jump to Zikni with, where does ADHD fit in with this?
Mm,
So we have like a family alphabet soup of mental health conditions. Talk to us about where ADHD fits in with OCD and BFRBs.
Yeah, there is a very big overlap between these conditions. Actually, one thing to consider, okay, so let's sort of talk it out. So, if you were to compare OCD and ADHD, ADHD, again, we're talking about the function. So, is somebody engaging in a behavior because they are having a lot of uncertainty and anxiety? That would be more OCD. Differently with ADHD, are they engaging in this behavior because they're wanting that dopamine hit? They're feeling very agitated. They're depending on the type of ADHD, maybe they're wanting to get um, yeah, they're sort of engaging in more of these sort of like impulsive behaviors. But the thing to remember here is it does require for everybody a pretty thorough assessment. Because what looks like ADHD, let's say if you're someone who bounces your knee and clicks a pen, you might go, oh, they're definitely ADHD. That's what that is. But no, they're having a large degree of anxiety, and that's a way of managing it. For folks with ADHD, they may take medications for ADHD, which can increase the chances that they have hair pulling and skin picking or a BFRB. We know that ADHD meds, there is a crossover there as well. But again, I'm a little bit off track, but again, the thing to remember here is these are different conditions. They can look the same. A thorough assessment would need to be conducted to understand the function of the behavior before we would start treatment, because the treatment, while they're similar, they're not the same exact treatment.
Right. So I just want to kind of reiterate that, like, looking at OCD, looking at ADHD, looking at BFRBs, sometimes the physical representation may be the same for many of them. So you really do need to do this kind of assessment with a treatment professional to kind of understand your why, right?
Yeah.
Like your the what is the function of that behavior. So
Yes.
I'll give like a layman example, and I'm gonna kind of, I've been self-diagnosing myself as ADHD as like, oh, that explains a lot of my
Yeah.
childhood. I think now that there's so much more information about ADHD, but I definitely used the BFRB, the hair pulling of my eyebrows and eyelashes, as a way to concentrate, as a way to focus
Yes.
at work. And so that's part of the reason why I do think I have ADHD, is
Yes.
because I just like figured out a way to cope, right? It
Yep.
wasn't a great way, but one day I'll actually do a proper assessment and maybe get the right help I need. But so far, I feel like the systems I have in place kind of mostly work for me.
Yes.
um, there was a question about, let me just pull it back. There was a question about SSRIs. So, do you believe that SSRI withdrawal can cause these symptoms? And so, first, obviously, preface, you're more on the psychology side, not the
Yes.
psychiatry side, but I'm sure that you see patients. And so, yeah, however you feel comfortable answering a question like that, please.
So the way that I'm not a medical professional, so I again will do that disclaimer. From what I understand, we don't yet exactly know the cause of these conditions. We do know that there is a huge genetic component, meaning your parent or grandparent or aunt or uncle may have had these conditions. And that is sort of one of the causes or one of the factors that can increase your chances. We do also know that environment, so medications, hormones, the stress of
Mm-hmm.
the environment, school, your living conditions, the stories and the beliefs that you are raised with, these environmental factors can also, quote unquote, you know, have an increased chance of getting these conditions. Again, we don't know the cause. And yes, sometimes for folks when there is a medication change, in this case you're asking about SSRIs, that can be one of the factors that tip you into having symptoms. And when I use the word tip, meaning it's not the specific cause, but enough factors but were lined up at the same time that
Yeah.
cause some of those symptoms to show up. So that's the way that it was explained to me, and that seems to be a lot of what I see in my practice as well.
Yeah, I think when it comes to medication, always, always, always seek that professional help and guidance on dosage and all those things, and kind of that guide of helping you with either going on or going off
Yes.
a medication, because it is like so individualistic. I mean, recovery in general is just so individualistic,
Yes.
despite having so many commonalities to our stories and to the myriad of origins of where these BFRBs where these BFRBs and other conditions come from. Like you mentioned genetics, you mentioned hormones, you mentioned environment. Like there's so many different factors that affect
Hmm.
um, even just like the personality of a person. Like I myself, again, like I definitely have a more highly sensitive nervous system than say my sister, who she handled a life event that I did not handle well. Like she
Hmm.
took it, and she was also 6 years older. So like
Yeah.
all these different factors come into play.
Yeah.
Um, Fowles asks, how do you self-diagnose? And so I think I mentioned that term, but self-diagnosis is probably not the way to go. I will say that, but it is the first step, right? It is
Yes.
basically self-diagnosis just simply means you heard about something and it sounded like you. And so you went to the internet and you looked it up a little bit more and it kept sounding like you. So that's what happened to me with ADHD, where I heard someone talking about it on Instagram and I was like, wait a minute. And then I dug in a little further and I was like, okay, maybe. And then now I'm looking for a place to get assessed and that kind of thing, where you get a formal diagnosis once you get assessed with a um, professional treatment professional. There we go.
Yeah.
Anything
Yeah.
you'd want to add there in terms of like self-diagnosis?
No, I think that the more you're talking about back to ADHD, the more online we see, we're starting to understand different ways in which these conditions present. The difference between they present with women and men. I think that social media has been a big reason some people are getting self-diagnosis because they're hearing for the first time presentations that they never thought or they secretly thought they were the only one. And then they're seeing that, oh, somebody else has my condition or my experience of this condition. So that's another way people are self-diagnosing right now.
Yep. Yeah. Like this whole platform of talking about BFRBs and OCD,
Hmm.
right? Someone
Yeah.
new who may have just joined is like, what do those acronyms mean? And as we're
Yes.
talking, it's like, oh, maybe I have that, or maybe you see it in someone else that you love, and so now you can go down the rabbit hole of hopefully good information at our pages.
Yes.
So in the comments, EC Akin asks, is recovery possible? I'm 28 and I have been in therapy since 16 years old, on and off, and I still live with my skin picking.
Yeah, I believe it is possible, but I do believe that recovery, the definition of recovery, is a very personal thing. Do I believe that recovery is like 100% perfection? No. Like, I think recovery is more about your wellness and your experience of life than it is this I just box you have to check. Like, you'll never pull a hair again. I don't think of that personally as recovery. I think of more recovery of if you do catch yourself pulling or picking, you are able to rely on the skills and practices that have allowed you to get sort of back to your life, and that you can get back on track pretty easily. That's what I would consider a really good recovery. But it doesn't involve like 100% perfection in that. I mean, I have had clients who have had 100% perfection, but I don't encourage my clients to have that as the goal because they do tend to be have so much shame and disappointment if they do have a slip. And sometimes with hair pulling and skin picking, you can do it unconsciously. You can do it without being aware of it. And so let's say you did pick a, without knowing, maybe even in your sleep. I've had clients who will pick. I don't want them to wake up and feel like they're back at square one. It's more about how much do you get back on your plan and how soon does it take you to get back on your plan?
I love that, and that to me goes back to your compassion piece, right? That idea of recovery is not Like the goal of recovery is not to stop; it is to make it small in your life,
Yes.
and that when you change the goal, then it makes it possible.
Yes.
um, and so, yeah, just hopefully you have a good treatment professional that understands BFRBs. Woo! Sorry about that. That
Perfect.
understands BFRBs, that can take you through these modalities, um, and help you in that way of, you're Kim, when you're saying like how quickly, like we call it bounce back rate. How fast do you notice that it's happening, and how fast you switch to a healthy behavior? That's the goal. That's the goal. I'm looking at, we have, oh wow, a bunch of questions. Jazzy says, my trichotillomania has now turned into a habit, and that's hard to get out of. What is the tip to stop that habit? So this is a great question, because habit versus disorder, or habit versus behavior. A lot of folks will say, it's not a bad habit. And scientifically, a habit is anything that's like automatic and the brain just does on its own. And so, what do you think here in terms of like the hair pulling being a habit, the hair pulling being a behavior, the hair pulling being a
Mm,
ritual? Like, what's the right words that we should be using? And what do you
yeah.
have to tell Jazzy, who says, my trichotillomania has turned into a habit and that's hard to get out of? What is a tip to stop that habit?
Yeah, yeah. So I actually think, Jazzy, you're not alone. I would say 50% of my clients say their picking is very focused, like they're doing it on, they know they're doing it and they kind of in the moment want to do it. And then I have a fifth other 50% who they like they said they will be like halfway through writing a presentation and before they know it they're like, oh my gosh, I've got all this hair or skin in my fingers, right? So I think that you're definitely not alone, and we want to specialize your treatment depending on what group you fall into. So if you are someone who pick habitually, we would then engage in implementing what we would call like competing responses or habit blockers for those who have this habit or habit aware, like the bracelet, right? Things that can bring to your attention that you're doing something like, subconsciously or unconsciously or without your awareness. So there are so many ways that you can improve awareness by, again, those sort of blockers, the things like something over your fingernails or gloves or covering the face or the hair that can slow down your habit of doing this behavior. Now, does that mean you're going to be perfect? No. Does it mean you're going to have to practice and practice and practice? Yes, because habits take time to unhabit. It's a process. So you have to be willing to be in it for the long term, but absolutely habit blockers and competing responses and habit aware are all really good tools for that.
Yeah, I love that sentiment of it's not about stopping, right? It's exactly what you were just saying before about it's not about perfection. It's about building awareness. So that's what the habit aware bracelet that Kim's mentioning. That's what we've invented. It uses gesture detection to bring awareness to hair pulling, skin picking, nail biting, so that that moment of pause that the vibration creates allows you to do this work to replace the behavior with something healthier and do the work that a treatment professional is asking you to do. So
Yeah.
awareness is super, super powerful. Um, and that idea of wanting to stop the habit, again, similar to E.C. Akin's question, it's not about the stopping, the full stop, right? It's about making it small. It's about slowing it down. It's about um, that bounce back rate. How quickly can you recover in the moment to the healthier strategies? Curves and Glam says something that's changed my anxiety around after 20 years is brain rewiring. Teaching yourself to speak differently with a more positive mindset. Also learning to breathe. It's a very powerful tool. So this goes back to your self-compassion. Like, tell us what you've learned in terms of how the self-compassion piece is helping folks in this way of brain rewiring and how you see the power of it.
Yeah. So self-compassion, just to be clear, isn't just kind words. It's similar to what Curves and Glam is saying, is it's not just what you say, it's how you say it. It's the tone in of voice, right? So instead of saying, like, let's use the example of there's a behavior you don't want to do anymore. You could respond by like, stop it, stop it now. Why can't you stop that, right? That's pretty aggressive and critical. But you could say very similar words, but in a tone that feels very, soothing, like, okay, Kimberly, you committed to not doing that. You really want to be able to reduce that. Is there something we could engage in right now that would be a different behavior? So they're the same thing, but the sentiment behind them, the goal behind them, the tone behind them are much nicer. Now, again, some people think of self-compassion as just letting yourself off the hook, like, oh, it's okay, you can just keep pulling. This is a really hard moment, or you can keep doing that compulsion because, you've had a lot on your plate and, you're doing the best you can. Well, that's really technically, it could be self-compassion, but it's not just letting yourself off the hook. Often, the compassionate act is doing the hard thing, but doing it in a very gentle way, doing it in a very encouraging way. So it's like they talked about. It's a coach. It coaches you through hard things, instead of leading you away from hard things.
I love that sentiment of compassion not being sort of the get out of jail free card kind of, right? It's not
Yes.
like, oh, it's okay, you deserve to pull. Like, you also
Yeah.
deserve a world where you don't pull, you know what I
Yeah.
mean?
Yeah.
And it takes work, and I love what you just said about it taking like that strength. It's exactly like, you know, it's exactly, just yes, like it takes strength to do the right thing by you, right? For
Yeah.
you. So I just love that.
And one thing I will add too is the practice of compassion is failing a bunch of times too. Like this is you have to. Let me sort of reframe that. I've never had a client recover who didn't fail many times before they were like, oh, I, c- I got through that. Like I could handle that. That they had to fail a couple times or several times or many times to get there. And that's a normal part of this practice as well.
Yeah, I'm thinking of something that just happened to me recently that's not even related to the BFRB behavior, but it's almost like we keep having the same things happen to us until we
Hmm.
learn the lesson,
Yeah.
you know? And so once we learn the lesson, then again, it doesn't bite as hard
Yeah. Yeah.
when that thing happens. So I really like how that idea of like, yeah, recovery and compassion, there's going to be bumps in the road, but it's how you handle the bumps. It's how you
Yeah.
talk to yourself when those bumps happen.
Yeah.
um we are at time. That went so fast. But
Yes, it did.
any last words of advice, of hope, of motivation for the folks listening?
I think that this is, number one, that this is doable, that baby steps make for very good medium-sized steps, and medium steps end up making big steps. So you just have to be willing to make those baby steps first. Um, uh, that's the main message, I would say. Just be radically kind to yourself as you go.
Yep. Radical kindness, I love it. To yourself, and then you can give it to others.
Yes.
We all
Yeah.
need it. We all need
Yeah.
more kindness in our world. So I
Yes.
love that. It was so awesome to spend time with you just now. One last, let us know where we can find you, your podcast, your Instagram,
Sure.
your courses, please.
Sure. You can go to CBT School, like Cognitive Behavioral Therapy, CBT School. We have a course on BFRB called BFRB School. We have a course on OCD called Your OCD Toolkit. I also have a podcast called Your Anxiety Toolkit, or you can follow me at Your Anxiety Toolkit here on Instagram.
Awesome. Thanks so much for your time.
Mm,
Happy BFRB Awareness Week. Happy OCD Awareness Week. If anyone feels compelled, please share these interviews with your community so that we can raise awareness, we can raise understanding and compassion.
Yes. Yes.
All the best. See you
All
soon.
right. Have a great day. Bye.
Bye.